I'm a doctor. My wife is a doctor. My wife is primary care. She works in a clinic setting, and each and every day she sees and I see people who are suffering, people who are sick unnecessarily, and also the fact of money, it's making doctors be productive and turning up the amount of reimbursement, and it's perverting the best of our professional values.
In like 3 minutes.
And we need to understand that there's a wealth that you can't put dollar signs on. And that's the wealth. That's the wealth when a person is doing well. That's the wealth when a person is feeling better and living up to their full potential and having joy and trust and caring for each other. And I think I personally support one healthcare system, one public health.
When I was discharged in 1945. I went to single-payer Veterans Administration Hospital in Wyoming, where I was going to school. And since then, I've depended on Veterans Administration single-payer medicine. So we have already one system, VA, throughout the country. We also have Medicare, which is Medicaid, which is also a single-payer system. Very successful. Why the hell can't the rest of the country receive the same thing?
I just wanted to give you a perspective a little bit from our point of view, since we often only hear from the patient's point of view. If we were paid Medicare rates for what we would do, we would be getting perhaps anywhere from 40 to 60% more than we get reimbursed when we provide services from private insurance. So what happens, and this is the way these insurance companies work, they have made contracts. They solicit people to be providers, and they make contracts. Their contracts for laboratory services anywhere from 40 to 60% of the Medicare reimbursement.
Wow.
So what they're doing is that they're taking money from the people who are trying to provide you with good health care and good laboratory services, pocketing that money, and and not giving you the services that you need, not paying for the people who are providing those services, and their CEOs are getting billions of dollars. So when you have a for-profit system that's providing health care, all of these issues arise. It's part of our capitalist system. It's proper, perhaps, in regular business, but our health care should not be a for-profit business.
You're correct.
Consider through private insurance that 30%, basically, from what I understand, of every health care dollar is going to a middleman. It's going to...
The American healthcare system takes 6 times the amount of paperwork that the Canadian system does.
Right. Try to make these...
Search. My husband did a search, and he found out that the CEO of Aetna last year made $30.8 million. $30.8 million, and the president made $8 million. Now, I mean, I don't know about you. I don't know anybody who needs that every year. You can't spend it, and it's all on our backs. You know? So what happened is they got so crazy with their, I use that word loosely, with their pricing and their billing and what they pay out. So these why they get these tremendous salaries.
Between the years 2002 and 2007, in that 5-year period, the profits of the 10 top insurance companies in the United States went up 482%. 5 years, 482%, while their charges to to their subscribers went up 89% increase in subscription.
I was at the D.C. rally, and there were it was a whole contingent of doctors for public health care. And, you know, the AMA represents a fraction now of the doctors in this country.
The AMA represents every year fewer and fewer, 20%. But of the young physicians, it's much less.
It just boggles the mind that every other country, you know, Australia, which everybody says is similar to America, and Australia went several years ago. What is it that is making everybody crazy?
PhD and sanitation in applied management, information management systems, and decision science. Now, I am here just to tell you guys that I've done a research on evaluation of social programs from 1972. I really started from 1932, but we'll start from 1972 to 2009.
If we could set up a forum, maybe a meeting with the congressman or something like that, for you to present your PowerPoint. I have your email.
Yeah.